Hello, and welcome to the webinar entitled Medicaid Billing for Health Aides and Special Transportation. This webinar is sponsored by the IAASE Medicaid Committee and the Embrace Software Company. The intent of this presentation is to provide public school administrators a general overview of the school-based Medicaid claim process in Illinois, specifically regarding the claiming of health aid and special transportation services for students with special needs. This is not intended to be a comprehensive guide, but rather an informational presentation of the general or typical process. Each third-party Medicaid vendor company will have a distinct process for documenting and or submitting health aid claims and special transportation Medicaid claims. Please direct specific questions to your district's cooperative or your Medicaid vendor. Before we start, there's a couple questions to think about. Currently, we have over 190 participants registered for this presentation. And the question is why? And I think it boils down to the fact that districts and cooperatives across the state provide health aid and special transportation services as directed by the student IEPs on a daily basis. And this is regardless of Medicaid eligibility or potential reimbursement. So districts and cooperatives are wondering, hey, we're already doing this. What is it going to take for us to be able to submit claims in these two areas? Often the barrier that prevents many districts and cooperatives from submitting Medicaid claims for health aid and special transportation is that there isn't an established system for documentation. For health aid, the daily documentation service is required, and it is cumbersome at times, but it does require that daily documentation of services provided. And along with special transportation claims, there's a daily documentation for round-trip bus attendance. So when districts and cooperatives are considering looking into billing for health aids and special transportation, another question arises, is it worth it? So before we jump into the agenda, just taking a look at a potential scenario for a health aid claim, just to give an idea of what this could potentially mean from a financial perspective for districts and cooperatives. This specific hypothetical example is for one health aid who's billing for one student. So this client member district, their health aid rate is $4 per 15-minute unit. Again, you check with your Medicaid provider about your health aid rate calculation, and they'll be able to assist you with that. But hypothetically, for this scenario, we're looking at $4 for per 15-minute unit. And you would take the $4 times 4 units, which there are 4 15-minute units in 60 minutes, to get to a $16 per hour rate. And then if you take the $16 per hour rate times 5 hours of direct services that the aide is providing to that student who has a medical condition, you arrive at $80 per day of a potential claim. If you take the $80 per day claim times the 5 school days, it comes up to $400 per school week. And if you take the $400 per week times the 4 weeks, you get to the month, so you arrive at the $1,600 per month for a potential claim. Then you take the Medicaid match, the $1,600 times the match of 50.74%, which is the current Medicaid rate for matching in Illinois, and you get to approximately $811 for a potential monthly reimbursement. Again, this is for one student and one health aid billing for one student. So then this gives you an idea financially of some of the information that can be connected to Medicaid reimbursement. So moving forward through the presentation, you have a better idea what the potential could be. So with that information, we'll go ahead and jump in, and we're going to explore the claim regulations for billing for health aid and for special transportation. We're going to look at some documentation requirements and some training and documentation options to assist some cooperatives and districts with kind of brainstorming, having different ideas about what they can potentially do to set up systems and establish those as systems. And then we'll take a look at the audit documentation that's required from this perspective. To start off, we'll take a look at school health aid services. The regulations, and these are from the U200 manual, and it states that school health aid services documented in the student's IEP provide assistance with activities of daily living and are necessitated by the student's medical condition. These service areas include, but are not limited to, transferring and ambulating, assistance with food, nutrition, and diet activities, bowel and bladder care, redirection and intervention for medically related behavior. And that is specifically, they state non-discipline related. It has to be medically related behavior. So school health aid services, they're provided by staff who've been trained and remain under the direction of skilled professional medical personnel or qualified personnel. Under the direction of, now this is an important note that HFS has for school health aid documentation, and that's described as work performed by a health aide under the guidance and direction of a supervisor who is responsible for the work, who plans work and methods, who is available on short notice to answer questions and deal with problems that are not strictly routine, who regularly, at least monthly, reviews the work performed and is accountable for results. The supervisor must co-sign documentation for all services provided by practitioners under his or her direction. So that's just an important note. We're going to talk about that documentation requirement later on, but these are definitely the areas that districts and cooperatives can bill for medically related services that are provided by health aid. To kind of drill down under each of those areas to provide specific examples of health aid activities that would qualify for billing under Medicaid, includes under the areas of transferring and ambulating, aiding and supervising students on the bus who need hand-on assistance with their movement and safety, assisting students with coats, aiding students on the playground, assisting students to ensure they move to the correct location, moving students from a wheelchair to a mat or other piece of equipment. And before we look at these other areas, it's important to note that there are classroom aides and one-on-one aides that assist a lot of students with their coats. And there's a lot that assist students on the playground. But in order to bill for Medicaid, these services need to be specifically required and related to that student's medical condition. So you wouldn't have class aides and individual aides billing for helping every student who puts a coat with their coat unless it's required and documented in their IEP that they need that level of service that's related to their medical condition. So that's just an important note with all of these descriptors, that it has to really connect to the student's IEP and their medical condition. In the area of assistance with food, nutrition, and diet activities, some of those sample activities include preparation of student food, assisting student with eating preparation, feeding the student, supervision of student for nutrition, food allergies, choking, hazards, or behavior. Under bowel and bladder care, activities include diapering, aiding students with toilet training, assisting students to restroom facilities, assisting with clothing, and supervising restroom visits for students who need assistance. Again, just because the service is provided, it has to be applicable to the individual student's medical need to be claimed for Medicaid. Continuing on with some of these activities, the redirection intervention for medically related behavior. Again, they specify it's non-discipline related. It could include verbal redirection, supervising student safety and behavior during unstructured times, timeouts, and in behavioral crisis. Specific activities under hygiene would include supervision or assist the student to properly wash dry face and hands, supervise or assist the student in brushing teeth, combing hair, and the use of tissues. Under monitoring for health status, some students require that medical support for monitoring diabetic students, monitoring students for seizures, heart rate, activity tolerance, etc., and then monitoring the students for his or her specific medical condition. And again, that would all be outlined in the IEP and throughout the IEP for those services and supports that would specifically be required. Other areas could include assisting a student with specific activities related to his or her health needs, assisting students with protective equipment, assisting students with physical therapy routine and or exercise. So again, these are all just some more descriptive activities that could be billed to Medicaid, as long as that is a need and it's related to the individual student's IEP and listed in relation to their medical condition. So that's just the overview for what is billable for for health aid. We're going to move into the special transportation claim section now. Special transportation, and this is again taken right from the U200 handbook, it states Medicaid funding is reserved for transportation services to and from school for children on days when they receive a medical service in school and specialized transportation needs are specifically identified in their IEP. And these notes are just added to just summarize briefly. So first of all, to bill for special transportation, the student needs to be Medicaid eligible. The student needs to ride the bus to and from school. The student needs to receive a medical service, which could include any of these: speech, OT, PT, social work, psychology, nursing. And the student has special transportation listed in their IEP for the days the claims are submitted. An important note here that is included in the manual is that transportation costs for a child with special education needs, as identified in the IDEA, who rides the regular school bus to his or her neighborhood school with non-disabled children, should not be billed to Medicaid. And this could be an example: maybe there is a speech-only student who is Medicaid eligible. They ride a regular bus to and from school, but the piece they're missing is they don't require special transportation. So to make transportation claims eligible, the student must require that service, and it needs to be identified in their IEP. That's just an important note. So you're not going to be able to build special transportation for all kids who are Medicaid eligible and ride to and from. It has to have special transportation listed in their IEP. Okay. So now we have an overview of both of those areas. We'll look at specifically at more documentation requirements for each of those categories. In general, this is what Medicaid requires for claims for Medicaid. And it just states that LEAs must maintain records which fully document the basis upon which all claims for reimbursement payments are made. You have to have all of the records and the documentation, including billing records. And it needs to be available if there is a state or federal audit. Another important note regarding the documentation requirements for Medicaid claims in Illinois is that LEAs are required to maintain service and financial records for up to 5 years after the payment of federal funds. Now, in a case if there's a litigation or a claim or an action involving records, that it might extend beyond the 5 years, but they need to maintain those records until that resolution is addressed. And these are the basic types of information that are required for all Medicaid claims: the student's name, date of birth. These items are typically already structured in your third-party Medicaid vendor's software that auto-populates most of these. Again, you would add the date, the service date, the therapist would, their description of their service. Was it face-to-face? How much time? Who was the therapist? So these are all those items. And then this is where the signature of the service practitioner supervisor for health aides would come into play. If it's required, that would be a use for that. So those are the basic requirements for documentation for all Medicaid services. And if we specifically look at transportation service documentation, again, it lists the LEA's requirement to keep all of this information on record. But the one I want to stress and point out is this bullet point where it lists the verification that an eligible student utilized the transportation service for each trip claimed for reimbursement. And this is the one that triggers that separate bus attendance record. Regular school attendance will not suffice to meet that. It has to be documented that the student rode in the morning to school and they rode in the afternoon. And so you kind of you have to have that AM, PM, and it has to specifically be related to the student riding the bus. Along with that, there needs to be documentation that indicates the student received the covered service on the dates that special transportation is being billed. Again, your third-party Medicaid vendor company has that structure and system in place that they know when the student receives speech therapy or occupational therapy on a certain date, and then they can cross-reference that with the dates of transportation record. So that's something that they will assist you with for that. But pretty much for transportation documentation, it's really having to have that separate bus attendance record to support that the student rode to and from on a day of service, that they received service. Health aid service documentation has a few more moving parts to it. Again, these are the service description areas that we covered previously. And this is just a sample of a basic type of service documentation. Again, every Medicaid vendor is going to have their own type of software or service that this information typically would go in. This is just a sample of what it may potentially look like, where you would have the date and then the service. Was it medical behavioral? It could have been educational. Maybe they documented the student was absent. So it just depends here, what your vendor has set up. And then it has service units, and some vendors will have you just put direct minutes. Some will have you do units. Again, that's how but that is a component that is captured. And then the service description. And Medicaid does direct that activities that are related to the service must be related to IEP goals. So any of these types of things will be related and connected back to the student's IEP, medical condition, and goals. So those are just examples under those areas. But if you have an educational example here, they work with the student for reading, math, and test prep, this would not be billed to Medicaid. It's not a claimable service because it's not a medical or behavioral, it's just educational. So those are just some important notes to keep in mind. For the minimum amount of one 15-minute unit, Medicaid requires 8 minutes of service minimally to be provided to claim up to that fully 15-minute unit. So if a aide provides service for 6 minutes, that would not be billed because it didn't meet the 8-minute threshold to allow for 1 unit of billing. That's another important note. And again, your third-party Medicaid vendors, a lot of times they have those systems built in that captures and converts the minutes to the unit. So, and continuing on with health aid service documentation, we're also have to address that all health aid records require a signature of a service practitioner supervisor in order to be processed for Medicaid claims. So you need to check with your Medicaid vendor regarding who can approve the health aid logs that are submitted, and they'll be able to give you that information. This is what they do. They're experts in this area, so they'll be able to help you with that. But then individual or class aid, I did double check with HFS regarding this specifically and prior to this webinar, and that in IEPs, we document individual aid or class aid, typically is how it's documented in an IEP. And both of these can submit medically related health aid claims. But HFS wanted to stress the importance that it's the service being provided and documented, that it has to directly relate to the student's medical condition, and it needs to clearly be documented in an IEP. So typically for a one-on-one or individual aid cases, it's really relevant. There is a significant medical condition. The student requires one-on-one support. Those aren't really the kind of claims that come into question. But for an example of a class aid claim could include a student who is in a wheelchair the majority of the school day, but functions independently, with the exception of using the restroom. So 3 times a day, the student needs assistance with utilizing the restroom, and a class aid may support the student with that activity, document it just for the amount of time that they were assisting the student, and then that claim can be processed. So that's a differentiation there. So you can, both individual and class aid can submit medically related health aid claims, but typically class aid support is very minimal and it's a lot less than an individual. But again, work with your vendor, working through some of those technical questions on that. They'll definitely be able to help you. And there's a general rule of thumb: if in doubt, don't claim. As a previous director, I would get some questions from some of our aides that were billing for Medicaid. And if it wasn't clearly aligned to the description of the services that we looked at earlier, then most likely it wouldn't qualify as a billable service. So my rule of thumb, if you're in doubt, just don't claim. You can, and again, your aides can talk to their supervisors and discuss certain specific cases, but most often, if it doesn't really align to those medically listed billable services that we listed earlier, it's probably not a billable service. So now for some training and documentation options. I mean, you guys have been given a lot of information. Hopefully you know a little bit more about health aid claims and special transportation claims. These are just some ideas that are being presented that you can potentially look at or build on or manipulate better to fit your specific district needs or co-op needs. So transportation documentation options. If a district or cooperative has their own transportation, they can supply bus drivers with a daily log to document each student's bus attendance. So the bus drivers would have a list of all of the students. They could have an AM, PM checkbox, and they could check that each day that the student would ride the bus to and from. If a district or cooperative contracts with a transportation provider, that may not be an option, but then you could consider having an aide or teacher take the daily attendance for each student who rides to and from school. Generally, if there's a special education route, and that route, they're on a separate bus, that bus comes to the school, and usually a team of people will come out, and teachers and classroom aides, they'll come out, get the students from the bus, make sure everybody gets escorted back to the school safely. So that's another opportunity. It's a natural opportunity that districts and cooperatives could use to capture that transportation data. And then once you have that data, either from the school staff or from the bus drivers, whatever your case may be, then potentially an office clerical staff could enter that transportation data into the Medicaid vendor system on a monthly basis. And it is a reminder, just keeping copies of those records for 5 years after federal funds are paid. So these are just some ideas for transportation documentation, because that is that extra piece that is required to submit the claims for Medicaid for special transportation. All right, the next area is a little more moving parts. Again, it's the health aid documentation. One option is, and some districts and cooperatives already do this, that they require their one-on-ones to document their daily service. And they utilize that data every time they come to an IEP meeting and look at, do we need to continue to support? Do we need to reduce it on any level? But you could look at incorporating the service logs as a standard process for all students who require aid support, specifically those one-on-one kiddos that are medically eligible. So that's just an option that you can use to incorporate that, and then also use that data to make IEP team decisions. And then you would have that data over time and documented to be able to use for Medicaid billing as well. You could have individual and class aides complete daily documentation for all services provided to specific students on a paper copy. So there would be a paper copy with the student's name at the top, and then along the side, time frames listed. It could be by 15-minute units, however you'd want to do that. And then any aide who works with that student could write in what services they provided and initial or sign by that services they had done. And then the service logs, those paper logs, could be turned into the supervisor for review and approval, and then the claims could be submitted. Another option could be to train the health aides to enter their service data directly into your Medicaid vendor program. And then the supervisors could review and approve the logs electronically. This again, you have to work with your provider to make sure what's in place, what can you do. They know all about this, so they can help you and assist you with what's going to be the best for your situation. Now we move into some audit considerations. It's always wonderful to get extra funding for services you're providing anyways, but then there comes that accountability piece, and we all want to be on top of that. Starting off with, specifically for Medicaid claims for health aides and transportation, ensure the IEP has clear documentation of the student's specific medical condition, and the services are incorporated throughout the document. So under the present level of performance, under the functional area, you would have descriptors of those specific medical needs and some challenges and services, supports to address those. In the area of accommodations and modifications, there may be some notes there about specific services and supports to help the student with their medical condition throughout the school day. Another area to consider and actually document data related to a student's medical condition is in the additional notes section. During the IEP, when the team members are discussing the specific services that are needed, they can be captured there and noted there as well. As long as they're within that document woven throughout, Medicaid won't have a problem with those services that you're looking at and that you're billing for, because it was clearly outlined in that IEP. The next area relating to audits is to follow all regulations noted in the U200 manual as provided by HFS. And this includes the retention of updated provider certificates, required consents and referrals, and all service records for the last 5 years. Again, if you submit claims and they get paid and then there's an audit, and then it comes back and the claims that were submitted didn't have a parental consent or they didn't have the right referrals in place, that would be a definite issue for a district or cooperative. So just making sure you have all of those things present and available. And then lastly, working closely with your Medicaid vendor to ensure all records are being maintained accurately and all claims are being processed in accordance with state and federal regulations. So these are just all some different ideas to keep in mind when you're considering billing for health aid services and special transportation. So that brings us to the end of the webinar today. Here's just some definite, some resources, links that you will have access to. We will have this PowerPoint and the recording of this training listed on the Embrace website and also on the IAASD website once the recording gets completed. So you'll have access to the PowerPoint and the recording on those two sites. This is my contact information. If you have any general questions, feel free to reach out. I'll be glad to help you with that. Very specific, process or claim questions, I just direct those directly to your Medicaid vendor. They'll be able to help you with that. So on behalf of IAASD and Embrace, I want to thank you so much for joining us this afternoon, and hopefully everyone has a little bit better idea regarding the requirements for billing for health aids and special transportation. Thank you very much. Have a great afternoon.